My name is Devin Madden. I use she, they pronouns, and I work at the Icahn School of Medicine at Mount Sinai as the Associate Director of Gender Equity in our Office of Gender Equity in Science and Medicine. I also work within the Institute for Health Equity Research at Mount Sinai, and I am currently pursuing my PhD in Education and Leadership, where my research focuses on bisexual plus populations, their well-being, and sense of belonging. I've worked in public health for over a decade, always with an emphasis on community engagement, and I've had the privilege to get to work on a number of LGBTQ specific initiatives. Establishing trust is critical to engaging the LGBTQ population and research, and every interaction that you have with your potential participant pool is an opportunity to foster that trust. Over the years, I've been grateful to have been able to cultivate relationships with a number of LGBTQ serving organizations across the city. In many cases, these organizations sit on executive boards for the research we're doing here at Mount Sinai. They're helping to shape the research agenda. They see the marketing materials, they contribute to the outreach language, they help build the research tools, and they leverage their frontline staff who are interfacing with the community every day to invite people into a dialogue about the research opportunity. However, my PhD research presented a different set of circumstances. I knew that if I were to ask these same partners to spread the word about my research opportunity with their constituents, they would need to trust that the opportunity I created would be a positive one for their constituents. Some of this was built in because they knew me, they knew the research that I had been involved with, they knew my principles regarding research. But because every moment is an opportunity to build or hinder trust, I knew that I really had to be deliberate about thinking through my messaging and what my ask of them was to communicate out with their audience. This included the flyers that I made. I needed to really make sure that I was communicating out the gate what I wanted to without inadvertently alienating anyone. This required a lot of reflection. It required conversation with my committee, trusted stakeholders around me, and getting feedback from other people in the community. But it was also a learning process for me. I identify as bisexual femme, and I'm an insider to the population I was interested in working with in many ways. But what resonates with one bisexual femme does not necessarily resonate with us all. And so along the way, even after my original flyers were approved, I had to shift my messaging to be more responsive to some feedback that I was getting around the eligibility being a little bit unclear. Of course, I went back to the IRB with these shifts. It paused my timeline about a week or so, but really holding myself accountable to being responsive to my community was the right thing to do and can only help build trust. I did rely on my community partners to help spread the word, but I also found other ways to get the word out there, knowing that not all LGBTQ people are connected to a community serving organization. I put flyers up in queer-friendly bookstores and coffee shops in different communities across New York. I promoted the opportunity on other queer community building platforms and/or platforms that I knew were queer-friendly. And I reached out directly to content creators that I thought the research would resonate with, asking them to help spread the word. The response was tremendous. I was asking people to commit to joining 3 in-person sessions. The sessions would range from 2.5 hours for one of the sessions and up to 5 hours for the other 2. It was a big commitment, but far more people than I could even invite into the actual study took part in that preliminary survey and expressed interest in participating. My messaging and the trusted messengers and outlets were of course helpful, but I will also say that my design was critical to the success of the project. We need more research with LGBTQ participants, but oftentimes LGBTQ people are made to feel like they're an afterthought or they're being tokenized. For these reasons, I felt it was really important to build a study that was A, responsive to a topic that queer people themselves are discussing and care about, even though the scholarly literature hasn't caught up, and B, is participatory in nature. I used a qualitative method called participatory narrative inquiry. I tried to mitigate some of the researcher-participant dichotomies that get ingrained in traditional research processes. And in this research, it really was that participants would share their own stories with one another, they would make sense of their own stories with one another, and they would come up with the results with one another, while also saying, this is how we want the results to be used. While this is not feasible for all research, especially certain clinical opportunities, it is always important to consider issues of agency and data ownership. All too often, research occurs and participants don't even know the outcomes of the studies that they participated in. This contributes to the distrust. Engagement is a continuum. We know that. And what your research can and can't do also exists on a continuum. But ongoing communication, especially about the outcomes, is a non-negotiable. Our LGBTQ participants deserve to know what happens with their data after it's collected. So the ending message here, the concluding message here, the summary of all of this is to think about trust every step of the way and be deliberate about trying to build it.